The very first thing I remember being taught in life, which happened to be inside the foster care system, is don't be a tattletale, nobody likes a crybaby, and big boys don't cry. I was probably 3. No, I don't know who taught me to talk, I don't know who was there in the room when I took my first steps, who held my hands, who caught me when I fell. Most people don't even have to think about this question because it never comes up, the answer is just obvious. It was my parents, my family, someone who loved me and they remembered it. Not quite my answer. Not because it wasn't written down. The system writes everything down. My case file actually started in Arizona, then it moved to Oregon, and it tracks every placement, move, code, and every allegation. So somewhere in that file, there is a record of who my caregiver was during this window when I was learning to walk, talk, and understand what this world actually is. I just don't have the full access to it. Yet. What I know instead is this. I was born into foster care, and the entity responsible for my development from day one, it wasn't a parent. Nope. It was a machine. A funding structure. It was Title 4E of the Social Security Act, a federal reimbursement mechanism that pays states a percentage of the cost of keeping children in licensed placements. From the first breath I took outside the womb, I was a billable event, and the people responsible for teaching me how to be a person were operating inside that structure. Some of them were good, some of them weren't, neither here nor there. All of them were working inside a machine that had financial incentives built into every decision that was ever made about me. Where I lived, how long I stayed, what services I received, and what I was taught to do, say, and feel. So every adult in my life was being paid to deal with me. So when I tell you the first thing I remember being taught is, don't be a tattletale, nobody likes a crybaby, and big boys don't cry, I'm not just telling you something that happened to a little kid. I'm showing you my real, true, and verifiable experience with the machine's first output. I'm showing you what the system built when it built me. This is my life inside the beast. First, let's run these 3 sentences through the architecture Fostering Reality is already mapped out, because they're not just something someone said to a child. These are behavioral modification protocols with documented downstream effects that the system later built to treat. First, don't be a tattletale. Can you say Federal Law 42 U.S.C. 13031? Mandates that certain categories of adults report suspected child abuse to appropriate authorities. That's the mandated reporter law. The people responsible for my care were legally required to receive and act on disclosures from children in their care. I was being taught at approximately age 3 not to make these disclosures, and I need you to hear who said it because the first 2 people I remember delivering that lesson were my own caseworker, the person the state of Oregon assigned to be my legal advocate inside this system, and a foster dad who also happened to be the county sheriff. Law enforcement, child welfare, the 2 categories of mandatory reporters the federal statute was specifically written to activate. Both of them in my life delivering the same instructions to a child in their care. Don't tell. Now that's not a parenting choice and it's not a lapse in judgment. That's the suppression of the primary mechanism federal law created to catch abuse inside placements, delivered by the exact people that mechanism was designed to activate and hold accountable. And every future report I didn't make, every flag that never got filed, every founded allegation that never got founded because I'd already been trained out of reporting, that traces back to this moment. This is where this series starts and this is where the architecture begins. Nobody likes a crybaby. What they're teaching me is to suppress emotional expression. The structured decision-making tool, SDM, which is the risk scoring algorithm most states use to assess children, scores emotional dysregulation as a risk factor, meaning if I display distress, that increases my risk score. But emotional suppression, the thing that they just trained me to do, that shows up later in the same system as concerning detachment, flat affect, and an inability to bond, which also increases my risk score, and generates a referral to a provider who bills Medicaid for treating the exact behavior the system coached me into. They trained me to fail the test that they're going to give me later, and they billed for the tutoring. Big boys don't cry. This one has a longer tail. What you're teaching a child is that emotional needs are a liability, that vulnerability is weakness, and that the correct response to pain is suppression and silence. That shows up later as diagnoses, and these diagnoses have codes. The codes have bills attached to them, but before I can give you these codes, let me give you the code books. There's 3 classification systems that run this machine, and you need to know all 3. First is DSM, that's Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. This is the Diagnostic Bible, the system that defines what counts as a mental disorder, what the criteria are, and what labels get attached to a child's file. Every clinician who ever sat across from me in a state-mandated session was working from this book. The current version is the 5th edition, DSM-5. Now when I was 3, they were running DSM-3. Same architecture, different build number. Next is ICD, International Classification of Disease, published by the World Health Organization. This is the global coding standard that translates diagnosis into billable numeric codes. DSM tells the clinician what to call it. ICD tells the billing department what to charge for it. The current version used in US is ICD-10, the 10th revision. When I was 3, they were running ICD-9. Every code I give you in this series will be ICD-10. The revision changed, the diagnosis it covers did not. Next is CPT, Current Procedural Terminology, published by the American Medical Association. This is the procedure layer, the codes that describe what the provider actually did in session and what Medicaid gets billed for. A diagnosis code tells you what's wrong with the child. A CPT code tells you what services were rendered and at what rate. CPT has been around since 1966. It was already fully operational when I was sitting in these chairs. This one didn't change on me at all. But quick note on version control before we go any further. The codes I'm giving you throughout this series are current build, DSM-5 and ICD-10. I am a SACWIS legacy case. SACWIS is a statewide automated child welfare information system, the original BEAST operating system. It was already running when my file was open. My instance of this machine was executing on DSM-3 and ICD-9. The diagnostic logic was the same, the financial architecture was the same, the output was the same, they just patched the version numbers. The exploit never got fixed. Back to the tell. So suppression and silence shows up as reactive attachment disorder, DSM-5, 313.89, ICD-10, F94.1, emotional unavailability, failure to attach. Those are diagnoses and they have billing codes. CPT 90837, individual psychotherapy, which is 53 to 60 minutes of face-to-face contact. CPT 90847, family psychotherapy, and CPT H2019. That's therapeutic behavioral services. The system that trained me not to cry is the same system that later identified the inability to form healthy attachments as pathology, requiring funding intervention and escalated behavioral placements.
Thanks, guys.
I was 3 years old and somebody was already teaching me to be a more billable product. Now, I grew up in counseling, and not because anyone recognized that I needed support, but because counseling is part of the placement package. A service and a system mandated. A provider the system selected, a treatment plan the system designed, and a billing code the system submitted to Medicaid every time I sat in the chair. CPT 90837, every session, every week, billed to EPSDT. That is the early and periodic screening, diagnostic, and treatment under 42 U.S.C. 1396D r. Because every child in foster care is automatically enrolled in Medicaid, and every Medicaid covered service generates a federal match. So here's where the carousel starts. A child in placement shows distress. That gets written into the case note. The case note generates a clinical flag. The flag triggers EPSDT assessment, CPT 99381 through 99385, a series of evaluation and management codes used to build for initial comprehensive preventative medicine visits for new patients. The assessment sends the child to a clinician. The clinician applies a DSM code, ADHD, ICD-10, F90.9, conduct disorder, F91.9, oppositional defiant disorder, F91.3, PTSD, F43.10, it doesn't matter which one. The code opens a billing window and the window generates a treatment plan. The treatment plan generates a prescription. It could be Ritalin, Risperdal, Seroquel, there's hundreds. Every prescription is a billable event. CPT 99212 through 99215, standard evaluation and management codes used to build for outpatient visits for established patients. For every medication management visit, the medication creates side effects. The side effects look like new symptoms. New symptoms generate new codes. New codes justify dosage changes, new medications, new management visits. Another CPT 99213, another Medicaid claim, and another federal match. And here's the part that doesn't make it into any report. Every placement move in kids in care average sometimes 7 placements. Some of us saw multiples of that. Every move resets the billing cycle. New placement means a new prescription physician. New physician means a new patient evaluation. CPT 99205, high medical complexity. New evaluation means a new treatment plan. New treatment plan means a new baseline assessment. Every single transition is a fresh billing cycle starting from zero, while the child carries every previous code into the next placement in a file the next provider reads instead of reading the kid. I went through counselor after counselor after counselor. Each one inherited my diagnosis. Each one continued my treatment plan, and each one billed for services, while the thing underneath all of it, the thing that generated every code and every flag and every prescription in the first place, it never got touched. Stability doesn't bill. Turnover does. I know this because I have my file. I requested it from the state. What I got back was severely incomplete, and the cover letter even says so in writing. They told me that they're still looking for the rest of my records. Decades later, still looking. Now, I told you the first thing I remember being taught is don't be a tattletale. I'm going to tell you why this matters beyond the obvious. When things happened to me inside the system, and things happened, The mechanism that exists on paper to document and address these things was the founded allegation process. Someone reports, someone investigates, the evidence supports it, and it gets founded. It goes into the file, it follows the placement, the provider, and the facility. Except that's not what happened. What happened is the thing I'm going to spend this entire series documenting. Founded allegations that became unfounded through an administrative process that had nothing to do with whether the thing actually occurred, and everything to do with protecting the placement, the provider, the contract, and the billing relationship. So I was taught at age 3 not to report, and the system had a process to unfound it if I did. Both these things are operating at the same time, the training and the erasure, working together on a child who didn't know either one existed. That's not an accident, that's the exact architecture. No, I don't know who taught me to walk. The answer is somewhere in the file I've never fully seen, maintained by a system that had a financial interest in every single decision it ever made about me. What I know is what I was taught instead. Don't talk, don't cry, don't report. Just behave better. And I know now, with years of distance and every federal document I've been able to get my hands on, exactly what that teaching was for, who it served, and what it cost me and every child who got the same lesson. This is Founded and Unfounded More. I'm Reality. I'm an over-fostered, unadopted, aged-out foster care survivor, and I'm reading the system's source code back out loud using the system's own receipts. Episode 2 is next, and it gets much more specific.